Soon after we announced this event, Matt Hancock very kindly kicked off the debate in public, and we had a massive debate around Babylon versus the NHS app. Jeremy Vine started the debate on Radio 2. So I'm delighted that the public have engaged into the topic today, reimagining the GP practice. I am the exec chair of and co-founder of Doctorlink, and really what I want to do today is give you my thoughts on how we see the world moving forward over the next couple of years. My background is in delivering health services, but I want today to talk about how, by engaging patients in technology, we can reimagine the GP practice. I'm going to focus on technology solutions, but I'm not naive enough to think that there isn't an awful lot we need to think about in terms of process change, people and skills changes. However, I don't have the time really today to pay attention to that, but I do know that the implementation, when we come to the implementation of these solutions, we will be putting a lot of effort in to those sorts of things. So why does the GP practice need reimagining? Well, there are problems for patients and there are problems for clinicians. They're driven by the increase in demand described by Jamie and exacerbated by the shortage of GPs described in the opening video. So you don't need me to tell you that the current system is broken. But can we imagine a different future? What solution do we imagine? Well, we looked at a study carried out by Henry Clay, who's here today, and he did this a few years ago, and he showed that between 25% and 50% of GP appointments were deemed to be unnecessary. We also analysed a lot of data from GP practices, and of course we run a healthcare service for 1 million people, so we're very close to the problems and issues. And we could see that there were many unnecessary consultations. We could see there were many self-managing conditions that were being seen by the clinician. And then we could see patients that needed a different service to that which the practice could provide. And some patients who could have been dealt with without the need for a face-to-face appointment, maybe an online chat with a GP, or maybe an email exchange. We could see that getting patients digitally engaged would really help address these issues. Unfortunately, today in primary care, there's no digital engagement. As a nation, we are proud of the service that the NHS provides and how, to a great extent, it has stood the test of time. But whereas in hospitals, the way the service is delivered is hardly recognisable now, in general practice, there's little change to the model. It's basically call into the GP, arrange an appointment, and then go and see a GP or perhaps a nurse now. If we look at the retail sector, there are some parallels. The big chains like John Lewis, Tesco and Sainsbury's have implemented large-scale digital programs which have changed their business models dramatically. But the corner shops have changed little. And the same is true in the NHS. The corner shops, the 7,000 plus GP practices with little money to invest, have not changed or adapted their model. Other sectors have embraced digital technology to transform their efficiency and to improve their consumer experience. New entrants have sometimes gone further and attempted to disrupt an industry, people like Amazon and Expedia. However, all entrants and all players start with the most common interactions before spreading out into other content and application areas. So banking started with statements and payments. Travel started with booking flights and hotels. Retail started by searching for and buying consumer products. However, if we look at healthcare, it started differently. Healthcare has had a fragmented approach. It's aimed applications at small cohorts of patients. These applications have struggled to get traction because there's been no natural connection to patient, because there's no existing digital platform upon which the specialist app can be added. It means there's little or no advocacy from the GP. because the apps aren't trusted or feeding into the GP world. So not surprisingly, there's been little take-up and it hasn't really impacted or improved the system. So what do we think the approach should be? Our approach is completely different, and we have started with the most common transactions: appointments, symptom assessment, repeat prescriptions. These are the volume transactions in a primary care world. 300 million GP appointments per annum and 700 million repeat prescriptions per annum. That is the beating heart of primary care. That's where, if we help improve efficiency, we make a real difference. But this is a complex business to consumer world. We can put some pressure in the system to encourage patients to use the app or the website, but unless we build best-in-class consumer experience, then they won't keep coming back. And some of the transactions we are building break the normal rules. We can't do a symptom assessment in 5 clicks. There has to be an engaging interface and a valuable outcome which brings them back time and time again. And if we build a product which delivers real benefits to the system, then the GPs will start to incent use of the system, and we create a virtuous circle. So, what are the benefits to the practice of digital engagement? The first thing is that putting your symptoms onto a computer or a phone is actually engaging, and people will spend the time going through a comprehensive set of questions. There's no pressure on the patient. It's all done in their time and at the most convenient time for them. At the moment, what happens is we all have to ring our GP practice at 8:15 in the morning and get in the queue. In this world, we put our symptoms in when we want to. The assessment feels very comprehensive and safe. And at the end of it, you get a conclusion, or more than one if we cannot get down to one conclusion. You then get to see information about your condition and comprehensive information about what you need to do to manage that condition. In nearly 20% of cases, the condition is one that can be self-managed, and we can give really good information about what's needed to be done. Getting this information on a computer or a phone is great because it's there for reference. And we can also explain any worsening conditions to look out for. Actually, more people than we expected are self-managing because the information on other possible outcomes leads them to the conclusion that they can self-manage anyway. So we are seeing in our pilots at the moment that up to 35% of people are actually self-managing after this comprehensive presentation of information. So with very good symptom assessment, we can put a filter into the system to prevent some of the demand on the GP. What's the next step on the journey? If you cannot self-manage, you need to be signposted to the best service. Now this is again where a system is much better than a human in doing this. Every CCG has a very comprehensive directory of service which contains all of the services and the opening times of the providers in that locality. So when a patient has done the symptom assessment and has been given a conclusion, it is then he or she is given a disposition. What should you do and when? So, for example, if the disposition is to speak to a doctor within 12 hours, and this is 6 p.m. on a Friday, it will access the directory of services and work out that the patient needs to speak with the doctor in the out-of-hours service. So the information on the assessment will be sent to the out-of-hours service and dealt with appropriately. In some cases, so that works extremely well. In some cases, the patient will be signposted to receive a diagnostic test. Often it's only after a blood test or other test that a condition can be ruled out. So the system will signpost the patient to the appropriate place where the test can be carried out. So the system is able to manage very comprehensively finding the best service for a patient. It isn't just defaulting to the GP practice, it is working out how to use the many services in the local health economy. And I have to say, the person who designed this approach is in the room today, so welcome Chris Watts in particular, because we're using some algorithms he's developed and they are extremely clever. So in the future we'll see many other approaches where this will work, and one in particular I point out, we'll see many more federated practices in these environments, and the system will be able to manage patients across the federation. So if one practice is doing all the urgent appointments on a Monday, the service finder will be configured to point patients to this practice on a Monday. The digital solution needs to be joined up into the local healthcare system. In this way, the patient will be pointed to the most appropriate service. The next advantage of digital is the ease with which communication channels can be opened up. I've been around for many years, and for many years we've been saying video consultation is the way forward, and it hasn't taken off. But the advantage of this new approach is that new communication channels in this world are there and part of the app, and therefore it is a seamless experience for the patient and the clinician. It's all done with one system, and therefore it's easy for the patient and the clinician to make that connection. If the patient does book a video consult, then the symptom assessment output will be waiting on the desktop of the clinician when the video consult starts. We actually think that chat and other forms of communication will be more popular than video consult, and there's a real efficiency in these methods of communication. We've evidenced that a clinician will be able to manage 12 consults an hour through chat compared with 5 or 6 in face-to-face. This efficiency is also helped by being able to channel people to the right specialist. So we can send someone with a diabetic problem to a diabetic nurse. We can send someone with a mental health problem to a mental health specialist. We can also send communication through to the patient's own GP, and where possible, they handle it, giving greater continuity of care and more efficiency in dealing with the patient. It also means that we can empower the supply chain. We can have people working remotely from the practice for smaller periods of time, so we can bring new cohorts of clinicians to work in the system. This new omni-channel approach is working very successfully in other industries, and I think it can help us to transform primary care. One thing we found in analysing the data was that something that people working in the system won't be surprised at, but there is a cohort of patients that take up a disproportionate amount of the practice time. 10% take up 44% of appointments, and these 10% on average have 22 appointments, compared with the other 90% who on average have 3 appointments per annum. So if we're really going to alleviate the pressure on the system, we do need to address the needs of the 10%. And when we analysed the characteristics of these 10%, it was clear the common characteristics are indicators of wellness. So the biggest differences were their BMI and their serum C reactive protein level. These are 2 indicators of being unhealthy, not being unwell. So there is more work to be done, but it seems clear we have to address the well-being of our patients, not just their acute symptoms. We have to encourage patients into behavioural change programs so that their conditions are improved and not exacerbated by their well-being. So what does the new world look like? The new world is a holistic service which starts off with us understanding our patients, using tools to understand the health and well-being of our patients. They then go through and are assessed. We will have many transactions where people want to put in their symptoms and find a service or book an appointment to get help with their symptoms. But there will need to be a step in the journey where we attempt to get behavioural change. And then we want to analyse the data. We will develop in this sort of ecosystem an awful lot of data about what's going on. So we need really good data analysis. And therefore we get to a system where larger organisations who get digital transformation have a total ecosystem in which there is starts and finish and measurement. So if we put all of this in, I think I've taken you through a digitally engaged population. And how will that benefit the patients and the GP practices? What are the outcomes from this? Well, I think we've alleviated patient and clinician problems described at the beginning. Primary care will no longer be the bottleneck and the challenging place to work. It will be an oasis of calm in the challenging environment of healthcare delivery. I leave you with my vision of an oasis of calm. Thank you very much.